Thank you for joining us for our webinar tonight, combining a 650 microsecond laser with topicals for the clearance of acne, presented by Suneel Chilukuri, MD, FAAD, FACMS. Dr. Chilukuri is the Director of Cosmetic Surgery, Chief of Dermatology and Dermatologic Surgery for Refresh Dermatology in Houston, Texas. He is a board-certified dermatologist who is an internationally recognized expert on cosmetic and reconstructive surgery. For over 20 years, Dr. Chilukuri has been perfecting techniques for non-surgical facelifts and advancing how cosmetic dermatology can help patients achieve their skincare goals. He believes strongly in sharing his knowledge and is an international trainer for numerous cosmetic dermatologic products and procedures, including PCA SKIN and Aerolase lasers. And so now I'm going to turn over the microphone to Dr. Chilukuri.
So for those of us who are traditionally treating patients, what do we know? We know that oftentimes these treatments are expensive. And in my last, in 20 past years, what we've noticed is that a lot more of the insurance companies are covering fewer and fewer medications, especially retin-A and retinoids. So a lot of times we're seeing that patients are finding that these non-covered drugs are going to be extremely expensive. Not only that, but there's a lot of side effects for the typical prescriptions that we write. Oftentimes with the generic retin-A, which is tretinoin, anywhere from a gel or a cream formulation from 0.025, 0.05, and 0.1, there's a lot of skin irritation that goes on, and we call it a retinoid dermatitis in dermatology. So that's the first problem. Even when you're using these benzoyl peroxides and some of these other medications with the combination benzoyl peroxide and clindamycin, we're still finding that it's drying out the skin. When you're talking about oral therapies, most of the antibiotics that we're using, the doxycyclines, the minocyclines, even Bactrim on occasion, these oftentimes cause a gastrointestinal upset, so upset stomach. And then, of course, long-term use leads to antibiotic resistance. In fact, the resistance is so terrible that for erythromycin, within a week or less, we're finding that there's topical resistance. Clindamycin, we're finding now what used to last 4 to 6 months before there was resistance, we're seeing antibiotic resistance as early as a month now. So it is becoming a nuisance, and we're trying to figure out what else we can do with our patients and how we can help them. My bigger issue, other than just the skin irritation and the cosmetic inelegance of these topicals, is that most of these medications take at least 90 days to really see an effect. And in dermatology, we used to always encourage our patients, hey, you know what, you're going to start seeing a change in about 8 weeks, and really at 12 weeks it's really getting on board, and then it takes between 3 months and 6 months to get a clearance. So that's fine, and patients remember that first day, maybe the second day they might remember, but within about a week when that medication is not working, and definitely by 2 weeks when the medication is not working fast enough, they're less compliant, they're less likely to continue using that medication, and they lose trust in you. How about traditional treatments such as isotretinoin, or what used to be called Accutane? Accutane in dermatology is a miracle cure. There is no question, but I'm going to show you in a few minutes some of the failed cases that we've seen with Accutane where we've had other options that we've had to use. In one case, you're going to see a patient of Dr. Michael Gold's who failed Accutane 5 times throughout her 20-year history with Michael. And we finally found something else that works, and I'm going to show you what that is. Actually, that's what we're going to be talking about tonight. In terms of Accutane therapy, it is a nuisance. Physicians, we have to register with iPledge. I'm not even an iPledge member anymore. I refer this out to our local colleagues because it is such a nuisance. There's a lot of side effects. It's expensive. It's inconvenient for the patient. It's inconvenient for the physician. What are some of the side effects that we see? The most common side effects are going to be dryness, severe dryness of the skin, the lips, eyes, or any other mucosal surface. You are going to have some sensitivity to the sun, and of course an upset stomach again. And in about 10% of the cases, you're going to see some hair thinning, and in about 15 to 20% of the cases, you're going to see a temporary elevation of the triglycerides. Of course, the whole purpose of this iPledge program is to make sure that we don't have people get pregnant while they're on this medication, because it is a known teratogenic effect for the baby. And really, where the jury's still out, does it cause depression, or does it aggravate somebody who's already predisposed to depression? So what do our patients think? And this is what the patient that comes into your clinic, this is what they're thinking. They're unhappy that we can't give them something that's quick acting. They're always looking for the McDonald's effect. What can we do and fix it yesterday? And then, of course, as we have this Dr. Google that's with us all the time now on our iPhones and our Androids, patients are looking up the medication that you're giving them, and then they start questioning what are the side effects of the drugs. And you have to remember, with the FDA, you have to label every single possible side effect that can be with that medication. Even those are not realistic. And then, of course, costs continue to go up. With Obamacare, we've seen that there's a dramatic increase in the cost of medication. With whatever Trump is trying to do now, it's not helping with the cost of our medications nor our insurance. And then, of course, there's inconvenience when we're talking about isotretinoin or Accutane. How about physicians and practitioners? What do we think? Well, we too are worried about the side effects of the medications. And again, what has happened with the evolution of medicine, whether it's with the HMOs, the PPOs, Medicare, we're finding that fewer and fewer of these insurance companies are actually covering the cost of these medications, or they're reimbursing even less. And I can tell you, for those dermatologists and physicians who are taking insurance, oftentimes this is billed as a 99213, which reimburses anywhere from $30 to $60 for this time and risk that we're taking with the patients. So is it worth the risk, and what are physicians really thinking? We think that the coding is a nuisance. It's more complex, there's a huge administrative cost, and oftentimes we're spending more time doing pre-authorization for these medications, and the patients are still not getting those medications. So we're frustrated that we can't help our patients and our friends here. So again, what do patients want? They want something that's going to give quick clearance. You want those minimal side effects, and you want something that's easy to use. The more easy something is to use, the more likely that they're going to continue with this medication, whatever it is, and hopefully get more cost-effective and long-term results. So a lot of times, as I look at to see what can we give our patients and what's not going to cause them to pay more at the pharmacy and have less of a result, because these medications are oftentimes cosmetically inelegant, I've turned to professional skincare. And I've looked and we've studied, not just me, but skincare experts, dermatologists doing biopsies. The skincare companies are able to show the efficacy of these medications and how similar, if not more effective than they are to the prescribed medication that we used to go to the pharmacy to pick up. They're definitely more convenient for the patient as they're getting it right then and there. And we as physicians and practitioners, we know that they're going to actually get the correct medication. It's interesting to see how these substitutions that are occurring at the pharmacy. So it's the point of sale. It's not what we're doing in the office. We may have written the exact medication that we wanted, but the patient is not getting this and not getting the effective treatments. Again, anytime that you make something that's convenient and something that's effective, you're going to have increased patient compliance. One of the biggest benefits that I've noticed is the cosmetic elegance of these formulations that we're seeing from a variety of skincare companies, and specifically with PCA, and I'm going to describe why that works in a few minutes. So what happens? Well, if the patient is happier, there's going to be increased compliance. There's going to be decreased side effects with it. If it's lower cost, everybody's happy, and when there's a happy patient, there's a happy physician or provider. So historically, what have we done? We know that, as we talked about, patients typically are prescribed topical antibiotics or oral antibiotics. Then we also go ahead and prescribe these retinoids because we know that we need to turn over that skin. So anytime we can take that normal skin, which should take about 28 to 30 days to turn over, and in acne-prone patients it can be 36 to 45 days, we want to increase that skin turnover to every 7 days. And how do we do that? That's with a retinoid. And the difference between a retinol and a tretinoin is that the retinol is the precursor. Because it sits on the skin and it's not been converted to tretinoin yet, it's not irritating to the epidermal layer or the outside part of the skin that we're seeing with our patients. Instead, typically it's going to absorb properly, and if you have the right formulation, it'll absorb properly and then become the active ingredient, which is tretinoin, inside the skin, deeper, where it's not sitting in an area that's going to irritate and cause that redness and dryness and peeling. What else do we see? Give me 1 second. Let me just move to the next slide here. Good. So It's not the most recent thing that we've done is use lasers. It's not the most recent thing. We've been doing this for almost 20 years, trying all these varieties of lasers, and unfortunately they've fallen short. We've used the pulse dye lasers, the KTPs, which are at the 532, 585, and 595 nanometers. The problem is the energy is being absorbed superficially really into the vasculature rather than the target, which is the sebaceous gland. We've tried infrared modalities as the 1320, 1450, a 1540, and even a 1510. So here we can get some effect of the sebaceous glands, but really it's more to promote collagen growth. And of course, we say, okay, we need to get in deeper. How can we get in there? Well, the traditional Nd:YAG is a pulse duration that's much, much longer than a microsecond. It's a nanosecond. And so we're getting this penetration, but we have increased risk of pain and scarring. So again, how can we give that ideal solution? Well, it's usually combination therapy, as we already know. So in this case, let's talk about how we can clinically suppress those sebaceous glands and kill off the P. acnes. And of course, if we do all the above, then what's going to happen? You're going to have a happy patient. That's the bottom line. And it's interesting because you do have to look at it from a financial perspective. If the patient is happier and they're coming to you, they're willing to pay and invest in their skin. And as a result, the side effect is that we as physicians and providers, we actually get paid. So it's an amazing thing. So we're saving the patient money and we're still able to give a great solution that's cost effective for them as well as being cost beneficial for the provider. So what's the difference between the 650 microsecond? So what we do know is that it does three different things, and it does it very well. One is it does coagulate the sebaceous glands. And again, those are the glands that we're trying to target with that high-dose vitamin A, whether it's topical through tretinoin or while it's oral, like the isotretinoin, which is Accutane. We do want to have a bactericidal effect, so this way we can kill off the P. acne, and we see that this happens again with the microsecond. It's a 650 microsecond Nd:YAG. And then what else can we do? Well, we want to block that inflammatory response by coagulating the blood vessels. So this is done quite effectively using, again, it's a shorter wavelength. It's a 650 microsecond versus the traditional Nd:YAG, which is a nanosecond. The advantages with this particular device, the Aerolase Neo, is that it's effective for all skin types. So it doesn't matter if you're type 1 skin or type 6 skin. The side effect of this is that it actually stimulates some collagen growth. So for those patients who have a lot of acne or who've had a lot of acne in the past, they may have uneven skin texture or even uneven skin tone or some acne scars. So the side effect of this laser while we're treating the active acne is that it does improve the skin texture and reduce some of that acne that's there. And what else do we know? We know that it can be used on teens with minimal discomfort. And the best part, and this is what our patient's favorite part is, they're seeing results in as little as 1 to 2 weeks in most cases. Here's an example of what types of acne that we can treat. And if you look at it closely, and if you're in the skincare profession, you realize we're treating all the types. What are the most effective that you're going to treat with the Aerolase Neo? The papular pustular, the nodular, and the cystic. The comedonal, yes, it does treat it. It's not quite as effective as treating the nodular, cystic, and the papular and pustular. So, but in most cases, you're going to find that you're going to have a variety of all of these. And in the past, I'm going to go back to slide one time. If you look to the far right of your screen, that cystic acne, we have never really had a great treatment for this, other than isotretinoin and that high dose of vitamin A that we're talking about. So what makes this different? Well, we were talking, so what is the normal Nd:YAG? It's anywhere from 3 to 30 milliseconds. And with the Aerolase, you're doing a 650 microseconds. So what does that mean? It's 50 times shorter pulse duration while still delivering incredibly high energy. Oftentimes I'm getting asked about a laser genesis treatment, and that's, is the next closest. It does not allow you to get this fluence. It's only a 200 microsecond, and the fluence is quite low. It's about 14 joules per centimeter squared. So you're not really powerful enough to truly destroy this acne and improve the long-term results. So when you're firing the laser so fast, what ends up happening, you don't have that thermal damage that occurs to the area around that particular chromophore that's being treated. So that's called thermal relaxation time. And the advantage of this is that you're hitting it so fast that it actually destroys the target without damaging the collateral skin. And this is a little bit of a busy slide, but you can see that with the laser energy on that second portion right there, as it's being penetrated in, it is going to have those three effects. It's going to actually decrease the sebum production because it's shrinking the sebaceous gland. It actually helps kill off the Propionibacterium bacterium acnes while also improving the collagen formation that's there. So it's a triple hit that's going on there. And again, this is what we talked about, that because it's heating it so fast and so quickly that you're going to be safe to actually have multiple passes, which is called pulse stacking. What is this? This just talks about that it's incredibly safe. So the one thing that I found from a practical standpoint, in the hair-bearing area of men, you can have temporary hair loss. So you do want to warn the patient of that. Now, obviously, if you have a blonde gentleman or a redheaded gentleman, it's less likely to occur. In fact, it's unlikely to occur. For women who do like to have laser hair removal, this is a positive benefit. So I do explain it to both men and women. Can you go ahead and play the video for me, if you don't mind?
Yep, I'm going to bring it up right now.
So if you take a second, this is just a short video that we shot in our office over the last few weeks, just to show you what it looks like in action. So you're going to see a Asian gentleman that's here. He has a type 3, type 4 skin. We're adjusting the settings. That second setting that she just turned to 150, that's how quickly it'll fire. That's the hertz. You do want to protect the patient's eyes, and then you can hear as it fires. So what we're doing first is we're treating that entire acne-prone area, and then we're going to go back and we're going to target those inflammatory pustules and papules. So again, this is a prototypical gentleman. It happens in that beard area there, and it's a very, very quick treatment that occurs, and relatively painless, quite frankly. Here, what you're going to find is that there's the next two slides actually just show us that it is proven. So Michael, David, and Mark Nestor, for those of you guys who are in the dermatology and plastic surgery world, you know these names quite often because they're some of the key researchers on these types of devices, and they've shown long-term results, and I'm going to show you a little bit of all of their photos in just a second. Again, we want science. I'm a science geek, so any of you guys that I've had the pleasure of meeting, it's really important to me, and you know that it's important to me, to make sure that there's a theoretical result as well as a clinical result. But if there's no theoretical result, it's not worth doing. And for those of you guys who've heard me present before, I always ask myself 4 things before I ever add anything to my practice. And the first one is the device or the thing that we're thinking about adding on, is it safe? If it's safe, the second question you have to always ask yourself, is it efficacious? So we know this is safe, we know this is efficacious. The third question that you have to ask yourself is this easy to use? Meaning, is the device very, very easy to use? And so you saw from that short video, yes, it's very simple. And there's a manual that comes with it that helps you really treat approximately 90 plus different types of conditions. So we're just finding new things to play with all the time on this particular device. And the last thing that you need to ask yourself is, does it make sense financially in your practice? What's the ROI? Because as much as I love using the Aerolase lasers, and as much as I enjoy working with Sean and Joe Hurley, who's the president or vice president, you know, I don't want to pay their salaries unless I'm making sure that I can break even on my device. And we paid this device off in approximately 6 months, a little over 6 months. And again, I do not have a high volume practice, and I don't see a lot of acne. This is just a side effect of what we're treating for our liquid facelifts. This is a typical medical dermatologist that's based in Oklahoma. It's a low-income area, and so he implemented the Aerolase into the practice, and that first month they treated 12 patients. And again, because you're doing repetitive treatments, you typically treat once a week or once every other week. It's a very easy way to recoup your investment that's there. For me, yes, that's important, but again, what's even more important is making sure that we have clinical satisfaction from the patient, because a happy patient, again, gives you a happy doctor. But this is a very, very, very typical result here. The device, it costs, if I'm not mistaken, Sean will send out the pricing on it, but it should have paid itself off for this physician within 2.5 months there. What can we do in addition to this? How can we enhance our results? Can we pre-treat with something? Should we treat post-procedure with something? And one of the things that I find is if we're pre-treating, typically I'll start a retinoid for 2 weeks, kind of get that skin prep, have everything coming up to the surface. So that comedonal acne that's there, the papular acne that's hiding underneath, it'll come up to the surface. And then on the day of the treatment, I'm going to go ahead and add on a salicylic acid mask for about anywhere from 6 to 10 minutes, depending on the patient and what they have there. What that's going to do, it's going to allow the Aerolase to be even that much more effective. So we're really seeing a wow. The salicylic acid, what it does, it is an anti-inflammatory, plus it'll kind of soak into the skin, soften the skin, so the Aerolase is going to be more effective as it's removing these acne bumps here. This is just a marketing slide, so it's not that exciting. This just talks about why PCA products are great. It's customizable, yes. It is it's a very, very high quality, very affordable and effective product, but it's a marketing slide. Here's some of the things that we use. And so I'll tell you my 2 favorite out of these. Yes, you can use the facial wash, which is on the left, but what our patients love is the BPO, the benzoyl peroxide 5% cleanser. It's one of the few cleansers that's out there that has benzoyl peroxide that does not dry out the skin. For people who like to wash in the shower, this blemish bar, which, unfortunately for PCA, it actually lasts for almost 9 months in somebody's shower if they're using it once or twice a day, is incredibly effective. Again, this particular product has 2% salicylic acid, which is going to calm down that inflammatory response that you're seeing with acne. But those are my 2 favorites. Here, out of these 3, what I use actually, our estheticians use all 3 of these, but I love the Purifying Mask. This is one of the things that we're using in the office as well to help kind of soften up that acne skin, and we can get that more of a result that goes on there. But I always send patients home with the detoxifying mask. I ask them to use it about once a week to continue to enhance what we're doing. So I'm going to go back 1 slide. So why do we send patients home with all these little products? There's usually about 3 products. One is the cleanser, one is the mask, and then here's the 3rd one, which is the retinol. Because they're going to get enhanced results, they're going to need to come to me fewer times, and they're going to actually save money in the long term. And that's what I remind all of these patients. What makes this particular retinol so different than anything else is the formulation. And I hate to say the vehicle that's in there because it's not sexy. But what the vehicle has is something called an omnisome technology. And this omnisome technology was bought from Johnson & Johnson, and it protects the retinol, which is usually a very, very unstable molecule. So because it's inside this liposome or this little protective omnisome technology, it allows the researchers to add other features into the retinol. So most times, why do we tell patients, hey, you know what, you have to wash your face, you have to wait 30 minutes, and then put your Retin-A on, your tretinoin? The reason is because Retin-A is such an unstable molecule. The biggest wives' tale is, oh, well, you can't use Retin-A in the sun. Well, it's not because it's going to harm you. It's just because the sunlight, even just the littlest bit of sunlight, will automatically deactivate that Retin-A, the tretinoin generic molecule, very, very quickly. The other advantage of the omnisome technology, it is a slow release. And so it penetrates deeper because it's a liposome, and it sits deeper under the epidermis and does a slow release. So it is very unlikely, when used properly, for a patient to dry out or stop using their treatment. The additional product in this particular retinol, which is intensive clarity for acne-prone acne-prone patients, is that you have salicylic acid, again, that's the anti-inflammatory, and you have a niacinamide, which helps correct the skin barrier. You have less transepidermal water loss. You can also add, if you want to, an acne cream or an acne gel. In our practice, this acne gel is a top seller for really both men and women, and in addition to teenagers, and patients love it. What it is 2% salicylic acid just calms down the skin. Usually we're seeing that acne goes away within 24 to 48 hours, depending on whether or not that patient is using a retinol. Clear skin, you do have to hydrate your skin. There is a product that's about to be launched, and I don't know if I'm allowed to talk about it, but I'm going to just tell you the name so you can start reading about it. It's called Hydrolux. That will hydrate the skin. It's a little bit more luxurious than this clear skin. This is very, very light, and the biggest mistake that occurs for acne patients is they think, oh, well, because I'm oily, I need to dry out my skin, and I shouldn't put a moisturizer on or a hydrator on. That's incorrect. So you do want something that's going to balance your skin so you're not trying to overproduce. Anytime the skin is too dry, it's a signal for the sebaceous glands to continue producing more oil. So it's a never-ending cycle. You're producing more oil rather than actually regulating your skin. Every patient, whether it's an acne patient, an anti-aging patient, man or woman, should be on a sunscreen, period. And the nice part about this, you do have a water resistance as well as the weightless. I can tell you as a guy, and for most of our men and women patients, they love this weightless. It's incredibly lightweight, doesn't smell like sunscreen. The Active Broad does smell like sunscreen, but it's quite effective if you're going to be in the summertime or you're working out a lot. And the advantage of the Active Broad is that there's antioxidants that will help prevent oxidation of the collagen, which causes breakdown of collagen in aging. So, we put this together. We do have a post-laser solution. You can see in the diagram here, and it really does enhance the results. But don't forget this intensive clarity. I do start for at least 2 weeks before they come in for the Aerolase to get more of a wow. If we have somebody that's coming in from out of the country or out of town, I do go ahead and treat with the Aerolase on the same day after putting in the detoxifying mask. And then I'll treat that same day, but it's not my ideal choice. So I call it Chili's formula. These are the ways that I use it. I do treat the entire skin like you were seeing on that Asian gentleman, and these are the settings. But again, if you decide that you're going to purchase the Aerolase, you're going to find that they'll give you all the settings. It's very, very easy to use. Then you do want to come back and you want to pulse anywhere from 3 to 15 times, depending on the skin type. Those individual acne lesions. We talked about at-home skincare there. How do we space it? We typically recommend that the patient come in once every other week or once a week, depending on how severe their acne is. The more severe the acne is, let's see them a little bit more frequently. Let's make sure that they're using their medications so they can get great results. I never tell a patient how many treatments we're going to do. I said, everybody's so individual. It's so hard to tell. It's like if you take a blood pressure medicine, one person's going to need 2.5 milligrams, one person's going to need 2.8 milligrams. Nobody can know unless we try. But what we are going to do is we're going to partner with you and make sure that we're going to clear your skin, and we're going to be teammates in this together. So here's just some examples, and I'm going to show you a variety of physicians here. The reason I'm showing you all these different physicians is because it's not just in my practice that we're seeing this. Amy Taub is a fantastic researcher. She has been with, she's done a lot of different research for many laser companies, and she's published widely. She's in Chicago, and you can see in this dry climate, after 7 treatments, yes, that's a lot of treatments, spaced 1 to 2 weeks apart, she combined it with 3 peels, and you can see this nice long-term effect that's going to go on there. This is the patient I was telling you about. This is Dr. Gold's patient. She has had 5 failures with Accutane. Originally it was Accutane, and then later it came out to be generic isotretinoin, but regardless, this is after her 2nd child, and she says, Dr. Gold, you have to do something for me. And he said, well, we've got this new laser. Let's try it and let's see what happens. And this picture, the post-op picture, is 2 years after that 5th treatment. So when patients ask, is this a long-term solution, I just say, I don't know. Everybody's different, but we are seeing longer results with this. And of course, if you're continuing with your skincare at home, you're going to see even greater results. Here you can see that we can treat a darker skin type. This is courtesy of Michelle Henry. I believe she's based out of New York, if I'm not mistaken, unless she's moved. And so we can treat all skin types. You can see here that this is predominantly comedonal acne with a little bit of papular and occasional pustule. But this is a dramatic change for 3 treatments. And this is a patient who's been on topicals and who's been on orals but has not been compliant and has failed multiple times. And she has a history of depression and does not want to go under isotretinoin oral medication. Again, David Goldberg, you saw his name up on the paper along with Michael and Mark Nestor. And you can see one month after 4 treatments, there's a nice change that goes on this Asian type skin. Despite being a melting pot, we still see a lot of type 1 to type 3 skin. This is a young woman that came in and is so frustrated with her skin and continues to pile on makeup rather than actually addressing the situation. So this is 5 treatments. And again, what's the longevity? This is 3 months after that last treatment. Here's Amy's patient again. This is after just a single treatment to kind of give you an idea where you're at. And this is what shows you why the patient is willing to come back and do additional treatments with you. Again, this is a cystic acne patient. Kevin's also based out of Chicago. Severe acne in a, I say middle-aged patient. She's more close to my age here. And this is after 5 treatments. You can see this nice clearance. There's still going to be an occasional breakout like you can see on her right perioral area. But again, you can go back after that. And one of the things that we offer is if somebody comes in, I'm going to go back one slide to Kevin's slide here. If you go back here, and she comes in with this one little blemish that's still left over, and we're not treating the entire face, we will go ahead and treat that area complementary. So I think that's important to recognize that we can do these things complementary because there's no consumable that's with this particular device, this laser. Again, this is a teenage gentleman. He's actually in his early 20s here, and this is after 4 treatments. There's dramatic results here. This is a patient who's failed Accutane because his triglycerides were through the roof. And then here we've got a young lady. Not only is her acne better, she has some acne that's active, but she also has a lot of this erythema that's underneath there. And look at the change that occurs. And this is after, of course, it takes a few more treatments because she has severe acne. This is after 7 treatments. Patients often ask, is it safe to use while I'm on Accutane? So we have had 4 different dermatologists in our local area who referred to me after seeing one of these talks in our local symposium at the Houston Dermatologic Society meeting. And yes, I treat through Accutane. It doesn't matter if it's the first month, 6th month. I think it's safe as long as you're not breaking down the skin. One of the things that it is important to remember that we do need to have some kind of evidence base because we're such a litigious society these days. And so there's been a paper that was recently published in the last 2 months showing that unless you're doing an ablative procedure or unless you're doing a ablative dermabrasion, that means you take the entire layer of skin off, we should be safe with most of our laser technology that does not break the skin barrier. So what's our take-home pearls here? Really, it's preventative. What can we do at home to enhance what we're doing? What can we do at home before we even come in for the treatment so you can get a more effective treatment? And then, you know, my favorite part is we're showing these patients what else we can do in our office. And I think that's the big advantage. Peels are an essential portion of our practice. I love using peels to help with hyperpigmentation. And why do I actually now exclusively use PCA peels. I've gotten rid of my other peels because they do so many different things. From a small standpoint, from a small company, PCA has over 1 million peels. And I think that's actually old numbers, over 1 million peels that are done each year. They're quite safe. This one is a PCA with hydroquinone, so it'll help more with the pigmentation. This is hydroquinone and resorcinol. So this particular peel I would not use with melasma. The resorcinol causes more heat that occurs versus the previous one. This is just a plain HQ, the hydroquinone PCA peel. You can see it's got lactic acid, salicylic acid, kojic acid, and a little bit of hydroquinone. This resorcinol does cause an increased heat, so somebody who's melasma prone, I would not use this one, but for everybody else, we can get a nice change there. So you're looking at what's an ideal solution, and I changed this slide out because it was the ideal solution is only with Aerolase and PCA. I think you have to use your brains and use your minds to see what is the pathology that's going on and what's causing some of these problems for that patient of yours, and what can you do. What we know is in our hands, we've seen this incredibly fast acne therapy. We're seeing changes, again, within 1 to 2 weeks, so it's a no-brainer. And from a physiologic standpoint, pathophysiologic standpoint, we know why it's happening, right? You're reducing the sebaceous glands, you're going to kill off the P. acnes, and the side effect when the P. acnes and sebaceous glands are clear is there's reduced inflammation. My favorite part is that in this melting pot that we call the U.S., it's safe for all skin types and all ages. Our youngest age that we've treated is a colleague of my youngest daughter. This young gal came in when she was 5. She had a huge acne papule on her nose. She's a plastic surgeon's daughter. He saw me using a live demonstration of the Aerolase, and then came and referred his daughter, called me and said, "Can you see my daughter?" "Sure, let's see if she'll sit still." Incredibly wonderful young lady, and was very brave. And I said, "Did it hurt?" She goes, "No, I just didn't like the light." So even though she had her glasses on. From a physician standpoint, what do we like? There's no cost and hassle of coding if you do take insurance. And then again, why shouldn't you make a happy patient and also get paid for it at the same time? I like being able to customize this. And of course, your at-home care is going to allow you to have that long-term result. This is my personal email, so if you need something or if it's something that you're curious about that I haven't addressed here, please reach out. If you see my Facebook pages, you can always ask a question on there, but I'm not as active on Messenger. Just ask a question underneath the videos. There's a whole video section if you go under Refresh Dermatology showing how we use this laser in addition to our PCA peels and skincare. With that, Sean, I'm going to open it up to questions.
All right, excellent. And thank you for that, Dr. Chilukuri. Most excellent. So this is the part of the presentation where we open up to the audience to type in their questions, and we will start with one here. So in the beginning of the presentation, you had mentioned that social media is a major factor for patients in acne. Now, do you find that to be a major driver of patient inquiries in your practice?
I'm seeing that as being a driver. You're correct. And I think it's more and more common. It's not just with social media, but just taking selfies. You know, our cameras have gotten better. You look at this new iPhone 10, they're talking about how the front camera is as good as the back camera and you can do all these fancy things with it. Well, that's fine if you put a caricature on your face and you don't see your acne. But if you're putting that caricature because you have acne, I think it's important to remember that we do have solutions here. And these are very cost-effective solutions. Depending on which region of the country you're in and how much work you're doing, we've seen pricing on just the Aerolase by itself as low as $150, and on higher-end stuff where we're doing combinations, we can charge anywhere from $250 to $350 depending on what we're trying to do here.
Okay. And now you had mentioned at the end of the presentation about combining with peels. We had talked about topicals, but then peels you're doing at the same time. Now, what is your protocol for using the laser and chemical peels for acne?
Certainly. So it depends on what the goal is. Typically I'm using one of the PCA peels pre-treatment, and that's for 2 reasons. One, I want to kind of soften up those the comedonal acne bumps, as well as the cystic and pustular acne bumps, so it kind of dislodges the follicular ostia, that's the follicular opening. And then I'm going to go over it, and I'm going to have better penetration with the Aerolase there. One of the questions that was also asked, I think by Rebecca, was, is Accutane and PCA peels, are they safe? Well, yes, they are safe. Again, you have to pay attention to what it is. It depends on which PCA peel you're using, because there's more than 10,000 PCA peels that you can use in combination. So the Sensi peel, which is the mildest peel, is incredibly safe. It has a TCA 6%, if I'm not mistaken, but it's quite safe. David asked, you know, if a patient does a PCA peel, how long should they wait before getting an Aerolase treatment, or does it matter? And what about a peel after Aerolase treatment? You can. You can do a peel after Aerolase, that's fine, but again, what's the reason that you're doing it? Are you trying to create a greater exfoliation? If that's the case, sure, you can do that. In terms of what I'm trying to do is I'm trying to dislodge the follicular ostia, open it up. So the question of how long do you wait in between the peel and the Aerolase, I don't wait. I take them from, if I need to transfer rooms, I'll do the peel in the esthetician rooms, bring them over to where the laser is, or vice versa. I'll just roll the Aerolase into the treatment room. For those of you guys who have not played with the Aerolase, I think it's pretty remarkable to see how small it is. It's in a suitcase, and the going comedy used to be, well, this is a yag in a bag. It can't be that powerful. If you really look at the technology and you see what the scientists have done, it is absolutely remarkable. They've taken this big box device, which does not need to be big, and shrunken it into a suitcase. So if you have multiple locations, you can just carry it, you pack it back up, it comes with the top, you pack it back up, and you just roll onto you throw it in your trunk or back seat, and you go to the next clinic. If you're in a smaller clinic like me, you can roll it from room to room, so you don't have to move the patient at all. It's pretty neat. The next question that was asked here is, how do you space the peels with the laser therapy? Is it done in the same visit? So yes, I'm going to answer that question again. So yes, it depends on what the goal is. For me, oftentimes I do the peel at the same time as the laser therapy. For those of you guys who just joined us, I do the peel first. I put a salicylic acid mask on there or a peel to kind of dislodge the follicular ostia, which is the follicular opening, and then I'll do the laser to get more of an effect. I can get better penetration. Somebody on here said thank you very much for saying that we did a good job. And there was a nice young lady who just wrote in here. She said, I brought it to Barbados as my carry-on luggage. Yes, that's the beauty of this thing. It's absolutely amazing. It fits right into the overhead compartment. I had the opportunity to work with a lovely young couple. I presume this is you. And she is married to a oculoplastic surgeon who's in Barbados, and says, do you think I could treat my patient's skin type? We have a lot of type 4, 5, and 6. I said, yes, in fact, let's do a little demonstration on you or your wife. And so that's nice to hear that you bought it and took it home. I think you're going to be very successful with it. The next question that's on here is, for patients that have hormonal breakouts, is there laser treatment to do during their cycle to head off a breakout? So that's what we're seeing with this Aerolase, and we don't know exactly why. We have a theory why. Because you're shrinking the sebaceous gland like you would with Accutane or high-dose vitamin A, we're seeing that there's fewer breakouts. You can combine this for hormonal acne with spironolactone to give you more of an effect that's there, but we're finding that oftentimes we're able to taper off the spironolactone. David, if that answers your question, I'm going to keep moving on. If it doesn't, will you type back in and give me a follow-up on that? For Lisa, she wrote in, what do you do on the first day of meeting the acne patient? Well, I say hello, and I introduce myself as the first thing I do. And then I talk to the patient, or actually our estheticians usually do the introduction, and they'll talk to the patient and ask, what is it that's bothering you? And how often are the breakouts coming? And is there anything that you've noticed as a, you know yourself better than anybody else, is there anything that you've noticed that has caused these breakouts to occur? Is it related to a certain activity? Do you notice it around your cycle? So we ask all those questions first before we actually examine the patient. And then depending on what the level of acne is, if it's something that's just comedonal acne and the patient is patient, we'll start them on the PCA Clarity, the retinol. If it's somebody who's inpatient, then we'll actually go ahead and I try to encourage them to do the retinol for 2 weeks before they come in for the Aerolase. But if they're very impatient and they have an event to go to, I treat them on the same day. And don't forget that to ask about bacne. We call that back acne or bacne. And it's very effective for that. We had a lovely young lady. She is 47 years old, 3 babies later, and she has continuously gotten breakouts on her back. She can't wear strapless dresses. And she was going to a party. I said, what if I can treat that and you can wear that dress that you haven't been able to pull out of the closet? She was so pleased, she brought 2 of her friends in and her daughter. So that's a nice change. Frederick asked, how long do you keep your salicylic acid mask on prior to laser? Typically, it's anywhere from 6 to 10 minutes. It depends on, how deep those acne bumps are, whether it's comedonal acne and whatnot. The next question, the follow-up question that you had is, Frederick, is how long do you wait to resume topicals? I actually encourage them to go ahead and start their topicals that same evening, as long as they're able to use that retinoid on a daily basis. If it's a new patient that's come in, usually they're still using the retinol only twice a week at the very beginning. So I keep them on their schedule, and they can take 1 day off of after the Aerolase and restart the retinol. But there's no reason to stop anything else. The next follow-up question, Frederick, I'm glad that you're asking questions. That's great. do your, I presume, do your estheticians do PCA peel prior to Aerolase? Hopefully I'm like a broken record. Yes, I do PCA peels prior to Aerolase. David, you asked, I still feel that there's a role for antibiotics? 100%. So here's the thing, David. I think it depends on how severe that acne is. And again, thinking as a dermatologist, what is it that we're trying to do? How frustrated is the patient? A lot of times the patients that are coming to me, I'm not their primary dermatologist. I'm just a cosmetic dermatologist. And so what that means is they've already been seeing somebody to get their treatments. So oftentimes they're on an antibiotic, and I'm taking them off of that. I'm going to wean them off that antibiotic. Sometimes with patients who notice that they just get their blemishes around their cycle, I just pulse that antibiotic for 2 weeks, the week before the cycle, and really depends on where they're breaking out. So there is a role for antibiotics. I think there's a role for all of this. How frequently can you repeat the laser treatments? Typically it's once a week, depending on the severity. If the acne is not that severe, I don't want patients to waste money, and I'll stretch it out to 2 or 3 weeks. And it's interesting, a lot of these lovely young ladies, they continue to come once a month, even though their skin is crystal clear, because they like the tightening effect. Do I or my estheticians do the PCA peels? My estheticians do. Frederick.
All right, I just want to make sure that
yeah,
I just want to make sure there's one in the chat function here from Dr. De Los Reyes, and she's wondering, can you combine the Aerolase with acne surgery? And the follow-up question to that is, have you had experience in using this in patients who are keloid formers?
Yes, so that's a great question. Thank you. So number one, yes, it is safe to use in keloid formers. I don't see any reason not to, and in fact, what we find is oftentimes with a short pulse Nd:YAG like this, a 650 microsecond, you're going to decrease the inflammatory response, and so what that does is you're going to decrease the chance of getting that keloid. So it's quite helpful for that. If you can shrink the keloid using a combination of Kenalog and 5-FU, and that's totally off topic here, you can shrink that, you're going to get even a longer term result by using your Aerolase, by pulsing it, and there's scar settings that you're going to find in your manual if you decide to get this device. So yes, it is quite effective. The first part of that question, would you repeat that first part of your question if you don't mind?
Yeah, it was, can you combine the Aerolase with acne surgery? Or
yes.
If there's, yeah.
Yes, thanks. So yes, I do combine it with acne surgery if it's needed. So I will do the PCA peel first, I'll do the Aerolase next, and then I'll do the acne surgery third, because I don't want to be hitting a bleeding lesion or anything like that. David asked, how often do I space the PCA peel? Well, it really depends on what the goal is. If I'm using it just to get rid of some of the superficial pigmentation, you can use the Aerolase in combination with that, and then I'm going to do it once every 3 or 4 weeks. If you're talking about how often do I space it for getting rid of acne, well, active acne, well, that depends. So usually if they have a lot of comedonal or cystic acne or pustular acne, I'm going to do it every time that they come. I'll just put one little light peel on there to kind of, and a mask to open up some of those, the follicular ostia again. David, did that answer your question? If it didn't answer your question, will you do me write in a follow-up if you don't mind? Anything else that I missed in the meantime?
One question we always get asked is, you know, when your patients come in, how do you discuss acne treatments with the laser? Is it one of the first things you tell them about, or do they come and ask you about it first?
Well, it's interesting. I think we have so much, our patients, especially the millennials today, it's not just the millennials and the above 65. They're so active on social media that they oftentimes approach or call me about it. And I don't do any advertising other than I use the social media just for education. I don't use it to bring in new patients. It's not my thing. I have word of mouth referrals. I've been very fortunate. But they come in off of that, or they'll say, hey, I saw you talking online or on Facebook about X, Y, and Z. And so that's interesting to see. And so they're coming in off of that. So what percentage of patients are calling in? Probably out of new patients, and we see anywhere from 50 to 90 new patients depending on the month. I think about 10%. It's either 10 or 11%. I can give you an exact number of, you know, once I get my numbers for the month of November, but it's between 10 and 11% are coming off of social media. for the new patient that comes in because they've been referred by a friend, which is much, much more common, I do say, you know, are we looking to gain a goal? Are we trying to get here faster? What is it that we're doing for you? Are you patient? Are you impatient? And I do just, and I say there's a reason for that, but you tell me first how your personality is, and then we can decide whether or not to use a laser. But I do describe all the modalities, and I actually describe, you know, that acne is a four-part thing. One is going to be overproduction of sebum. When there's overproduction of sebum, then the oil actually blocks the follicular ostium, which is the follicular opening. When that happens, the Propionibacterium acnes, which lives inside each one of our skins and faces, is going to have a nice, warm, moist environment to grow. And then as it's growing and it's causing more of this P. acnes to occur, then what I find is that you're going to get an inflammatory response, which causes the redness in the papule or the pustule. So I talk about each one of the things from a pathophysiologic standpoint, how to clear that. So how do we clear the sebum production? Well, the best way to do it is either high-dose vitamin A, which is Accutane, but the side effects often outweigh the benefits for most patients, not every patient, but most patients. But we do have a laser that can help address that. And we talk about, you know, they don't care what the name of the laser is, they just want to know there's something there to treat it. And then I go down the line, what do I do for comedonal acne, which is going to be, now you got the follicular ostium that's plugged up. Well, I talk about retinols, and I talk about the PCA retinol and what the benefit is versus a prescription strength versus some of the other physician grade or physician lines, and why the PCA is what I chose between everything else, because I used to carry a lot of the Skin Medica retinol, which is a great retinol as well, but it's more drying. So I kind of, yes, I do. In my initial consultation, I'm sorry, that was a long-winded response. That is I do bring up the laser. I sure do. The next question was by David. What is the role of injected steroids for acne? Well, it depends. If you have a significant papule or pustule, I think that you should inject a little steroid as long as you know what you're doing. So if you're well-versed in it, it's worth putting it in because you can get a clearance within, again, 24 hours. And you combine that with the Aerolase. So in this case, I actually put the steroid in first, and then I shoot the Aerolase in single pulses over that area 5 to 13 times. Sometimes 5 to 15 times, because I want that steroid to spread out and not cause any kind of depression there. LaShawn was kind enough to ask, do patients ever get worse breakouts initially after the laser treatment? We have not seen that, which is interesting because I think retinols do cause a lot of that underlying acne to come up, but I have not seen the breakouts get worse with this particular device. The next question is by Clayton. Do you find the Aerolase to be safe with potentially photosensitive medications such as oral doxy? We have used it safely for patients who are on doxycycline, minocycline, and even tetracycline. So we haven't seen any photosensitization for this particular device because the Nd:YAG is not really targeting the red. So I don't know that answer. You know, Sean, has anybody done clinical research to see if it's theoretically, I know theoretically I think it's safe, but has anybody done research on that?
No, and I think this comes back to the article that you referenced about the Accutane that came out a couple months ago to say that it's relatively safe outside of the ablative modalities. Yeah.
So I do, Clayton, I do use it with patients who are on doxycycline, if that's the question you're asking. What do I do for acne scars? Well, I do that, you know, I do the full face pulsing, and I'm going to do it anywhere from 5 passes to 9 passes, depending on the person and skin type. And over the areas where there's acne scars, I'm going to trade out from the 6mm spot size, 5mm spot size, and then a 2mm spot size, so I can focus in on those depth of scars. Again, acne scars, for those of you guys who've seen my Facebook posts and videos, even the Facebook Live, you know that it's a multimodality condition. There's no one great treatment for acne scars. This is just one more tool in our armamentarium, and you know, it's just another option that you have that I use in combination.
So now, with respect to time, we're coming up on about the hour mark here. So if anyone has any more questions that pops up, please do let us know, but we will be ending the presentation now. So again, thank you for joining us tonight. Dr. Chilukuri, thank you so much, and thank you for everyone to ask questions.
Thanks for having me. Appreciate it. Thank you guys for signing in on a Wednesday night. Appreciate it.
Everyone have a great night. Thank you very much.